Hi, this is Maya Steinbrück, and in today's video, we're going to be talking about the psychological implications behind injury, specifically in this ACL rehabilitation portfolio project that I've been working on. We're just going to talk through the importance of sports psychology. So, the reason that psychology is so important when dealing with injuries and coming back to sport is because so many studies have shown that athletes who go through ACL reconstruction surgery, many of them don't actually return to their pre-injury abilities or even return to sport at all. And while the ACL in testing has been shown that it's stable after rehab and the athlete is cleared to return to sport, psychological factors that affect their confidence in their own knee and their own abilities and the fear of re-injury is great among these populations that go through this. And the same study indicates that up to 45% of athletes fail to return to their prior level of sport participation, with psychological factors such as fear of re-injury, biomechanical deficits contributing to this limitation of not being able to go back to sport. So, just a couple factors of sports psychology, we'll go over a couple of these today, is going to be locus of control, so feeling in control of your own rehab plan. Self-efficacy is also self-confidence. Team dynamics and social support is really important as well. And then motivation, identity in and out of sport, and also pressure that sports and injury places on an athlete. The first one we're going to talk about is locus of control. This is the individual's perception of who or what is responsible to what happens to them. So there's two types, an internal and an external locus of control. An internal is defined by the individual believing that they have control over the events that occur in their life, such as injury. This contributes to success or failure being attributed to their own efforts and abilities. And for an injury application, they might believe that they can control their recovery and their return to sport through their own work and effort in their rehab plan. An internal locus of control is also associated with high self-efficacy, which is self-confidence and satisfaction with their knee function, returning to higher sport activity levels, and returning to sport at 12 months, which is when ACL rehab is supposed to be finished. And that's from a study done in 2016 by these authors. And then an external locus of control is where the individual believes that an external factor like luck or fate or others' actions is the cause of what happens to them. And this also shows that success or failure is based on external factors rather than that internal where they're actually in control of it. And for an injury application, this would feel like a loss of control. It would hinder their motivation and their active engagement in their rehab plan because they don't think they have any say in it. And next, self-efficacy is highly tied to locus of control, like we talked about. And this is really the athlete's belief in their ability to succeed, directly related to their skill level as well. And this can be a predictor of risk taking in sport, whether or not they're going to branch out and take risks in the game and in practice to impress coaches and also improve their own self-confidence in their own abilities. And a positive self-efficacy versus negative self-efficacy influences their motivation and effort in sport and rehab. It also is tied to resilience, perseverance, and adaptiveness in adversity, like injury, stress, or pressure in their sport. And then fear of re-injury is relatively normal. When you get injured, there's going to be some part of you that's scared of getting hurt again because you know what that's like. But a severe fear is unhealthy and it can turn into decreased functioning and challenging oneself in rehab because of that fear of re-injury. That turns into something called kinesiophobia, which is that fear of re-injury and fear of movement in general because you're scared of getting re-injured. And negative self-efficacy and confidence can negatively impact rehabilitation if it creates anxiety and fear around certain movements, like that kinesiophobia. And mental health during sport really looks like prioritizing community over isolation. And the impact on mental health can depend on an athlete's individual degree to which they identify with their sport and role as an athlete. So it's kind of what I was saying when we talked about identity in sport, whether that's rooted in who they are as an athlete or who they are as a person, is really important in determining how they see themselves in injury, whether that's worth or worth less almost. And then another part of self-efficacy is really having realistic expectations and setting attainable goals in rehab phases so that they can have positive effects on the athlete's health and self-confidence because by meeting certain markers, they can show their improvements and growth and see that progress as they come. And then some beneficial techniques to improve this would be imagery and mindfulness, something like meditation, and also visualizing yourself not getting hurt again when you return to sport. Also, goal setting, like I said, having those realistic expectations for yourself so you can track that progress. And cognitive behavioral therapy is a type of psychology in general, but clinical counseling that can also help with that, and social support as well is a big piece. And then psychological readiness is the third thing that we're going to talk about today. Because distress is caused by injury, there's a physical injury with psychological distress, they kind of happen simultaneously. So studies show that depression, anger, denial, anxiety, isolation, and post-traumatic stress is amplified more with severe injury, which, as we've talked about, ACL injury is a very serious injury. So there's certain tests and surveys that we can take that have been proven to be helpful. The first one that we're going to talk about is the ACL RSI survey. It was developed in 2008 as a tool to evaluate an athlete's psychological readiness for returning to sport, and this one's specific for an ACL injury. And there's a long version that's 12 questions or a short version that's 6 questions. And a higher score would indicate a greater psychological readiness, more confidence in your knee and your functional abilities, while a lower score would indicate the opposite of that, not feeling as ready and not being as confident in your knee. Typically, this is given to athletes around that 6 to 12 month of in their rehab plan, as that's the crucial stage when they're really focusing on return to sport movements and the athletes progressing through jumping, cutting, and sport-specific training. So that's the best time to give it to them since they're right on the edge of being able to be cleared for sport. And then the fourth part of sports psychology that we're going to focus on today is self-determination theory. And this has 3 parts to it. So autonomy, competence, and relatedness. And this is a theory that determines how ready an athlete is going to be to return to sport, and it kind of evaluates where they are at in their current rehab. And how they can perform outside of the rehab. So autonomy is feeling in control of your own path and rehab, sort of like locus of control. It's being able to make decisions and being involved in decisions throughout your rehab program. And this also having autonomy and decision making inside of your own rehab plan makes athletes more motivated about their training and goals so that they can reach them quicker since they're physically involved and mentally involved. The second one is going to be competence. And this is the ability to do something successfully and effectively, and it relates to an athlete's skill and ability level. It drives their motivation, and they can see consistent progress and growth in an ACL rehab journey when they're feeling competent in one movement and moving on to the next and mastering those things and getting those skills back. And feedback also reinforces this. Feedback from a physical therapist, a coach, or even teammates and friends can be really important in helping an athlete see their own competence. And then relatedness is a feeling of belonging and connection to teammates. Like I said, social support is extremely important. So feeling related to your teammates, even though you're injured, feeling related to your coaches and knowing that they care and have understanding for what you're going through. And also sometimes like a support or injury group can be really helpful, whether there's other athletes on the team that are injured that they can connect through that. Yes. And then also being able to push through challenges. It really helps to have people supporting you to be able to have that determination, like self-determination theory, to push through those challenges. And then this is a practical application of returning to sport. So this is a case study done on an 18-year-old male that sustained an MCL and an ACL tear. And he stated that he had flashbacks of the initial occurrence associated with a heightened anxiety response over re-injury when imagining himself returning to sport. After a psychologist evaluated him, he showed that he had a depressed mood and post-traumatic stress following this injury. And then their intervention was to do cognitive behavioral therapy. I think they did this for around 6 to 12 weeks. And the intervention was used in this specific case, and it had really positive effects. So it showed to desensitize the athlete to the fear of re-injury, leading him through specific moments where he was feeling those things, but learning to be okay with them. And he also had a decreased physiological symptoms present. So that just shows that when we're addressing the body, we also need to address the mind because they can be interconnected and one can cause symptoms in the other. And then also increased self-efficacy and adherence/motivation to the rehab plan, and an improved sense of control throughout recovery. So, in this specific case, CBT therapy was very positive in showing effects that helped this athlete return to sport and feel more confident in himself and his abilities. And then just to conclude some things we talked about, there's such a large correlation between the psychological and physiological factors that influence recovery from a traumatic event like injury. And it's essential to create a very supportive environment for athletes to experience negative emotions around the injury and encourage professional help, not to change those negative emotions into positive ones, but just to have confidence in themselves that they can come back from a negative experience. And it's also important for clinicians, the physical therapists, and coaches to understand where the athlete is at so that they can assess where they are and also encourage their progress in their scope of practice and refer to a sports psychologist if necessary to address some of these things. These are some of the research that we talked about today. If you wanted to take a look at more specifics and look over those. Thank you.